Hey, welcome back again. This is Robby and welcome to another Manual Monday. Today we're going to be talking about patella tendonitis. So patella tendonitis in young kids, it's also called Osgood Schwatter. It's basically inflammation of the insertion of the quadricep muscle, and where it ends up causing pain is at the insertion point, which is right on the front of the knee, right below the kneecap itself. So what I'm going to do today is go through a couple techniques that can be done at home as well and helping manage patella tendonitis. And this is just, again, I always advise people to seek medical advice, but some of these techniques are conservative and they can be done at home if somebody wants to attempt them. In the same breath, I'll still say I recommend you consulting with a physical therapist before attempting these things. But let's go for it. So to start with, what we're going to talk about is just soft tissue mobility of the patella tendon itself. It needs proper mobility. The insertion for this whole big quad muscle all comes to a point right here. So what we want to do is just keep the soft tissue mobility, which means the tendon needs to have the proper ability to glide and slide, and we want to keep a good blood flow coming to this tendon insertion here. So all I'm going to do is use this little tool here and some emollient is to move around the edges of the tendon itself. So we're going to go with it parallel, almost bumping up against the kneecap and down to this insertion point here. It might be slightly uncomfortable. And then we're going to just bump up to the edge of the tendon here. So we have two techniques. We have one where we're going perpendicular across the tendon, and another where we're going to go parallel and with the tendon, just like that. Now I'm using a tool, specialized tool. You could also use the handle of a butter knife, right? And just to give yourself just a dull edge, basically. And this is just a stainless steel tool. And just to kind of work yourself very gently around the edges of that knee joint and at the insertion point there. Because all this is real close to the surface, it's easy to influence the tendon because it's just below the level, just below the skin here. Okay, and then obviously you can work up here around the kneecap itself, and this is just to mobilize the skin and the tissue right around the kneecap. Okay, so next we're going to talk about patella mobs, which is just simply moving the patella around and making sure that it's not stiff or rigid in any one direction. So first we're going to go lateral, which will be catching the outside edge of the patella and just moving it to the inside, gliding it just like so, through pain-free range. We don't want to push into pain, we just want to, maybe a slight discomfort, but not too much pain there. Moving that patella immediately. We're going to go lateral, just gliding it. 1 second, 1 second release. And then the same thing, we're going to go up and down. Up and down. Up and down. Up and down. Like so. So you're just getting the upper edge and the bottom edge, up and down, the medial and lateral edge, and we're going to go side to side just like that. And these could be done at home. You just want the leg in a kind of a relaxed position, and that'll do just fine with that. And then third, now we have this fancy little ice cup deal here. But what you can do is get mouthwash cups, fill them full of water, and then put them in your freezer, tear off that upper edge, and use that for your own self-ice massage at home. So the patella tendon is the space below the kneecap, inserting there. So what we're going to do is we're going to do a cross friction here up to the edge of that kneecap and down to that insertion point. Cross friction. See how that works? Now we're going perpendicular. So we're going to do the same thing we did with the tool. We're going to go perpendicular and then we'll go parallel. And kind of using that edge a little bit We'll go circular motions counterclockwise, and then we'll go clockwise as well. And this is actually the best way to deliver cryo to this particular area because it is direct contact and you're actually providing pressure, which helps it penetrate more. And like I said, since that tendon is so close to the surface, this is the most effective mechanism to deliver cold therapy to the patella tendon itself. Now obviously we can work our way around the knee joint up into that medial quad and just circling around that patella itself. We can go at the joint line for medial meniscus pain, right? You can really work into there. This is a familiar area here. So right around that joint line, that meniscus is really close to the surface again. So again, this is a great way to deliver cryotherapy to these specific tissues at the knee joint. It's the most effective way. Okay. And lastly, just to leave you with a piece of equipment or something that you can use to aid yourself if you're struggling with patella tendonitis, is a patella tendon strap. This is specialized for the patella tendon. It has a small piece of rubber in here that actually presses into the patella tendon and it keeps it from bowstringing. So it keeps it from kind of pulling away as it's working and functioning. So what it does is it goes right below the kneecap, right at that knee joint. We're going to lift up the knee slightly, and this will slide on like so. Just like that. So all it does is keep some tension on the patella tendon, and it makes walking, running, moving much more comfortable. So if you're dealing with pain in the front of the knee, right around that kneecap area or in that patella tendon, you definitely, and you're going to be running or exercising, you definitely want to utilize a patella tendon strap. Alright, so there are some tips and tricks for managing conservatively patella tendonitis at home, and come back for another Manual Monday next week.